Let's be real, if you've ever dealt with acne, you know the frustration, right? All the conflicting advice, the so-called miracle cures that do absolutely nothing, and that feeling that you must be doing something wrong. Well, what if we've been looking at it all backwards? Today, we're going to cut through all that noise and get right to the medical facts. First things first. If you've had acne, you are not alone, not even close. A massive 85% of adolescents get it. So this isn't some rare personal feeling or something you did wrong. It's an incredibly common, totally shared part of life. Okay, so if it's that common, why is there so much confusion? Let's get to the million-dollar question. What's actually happening under your skin that causes a pimple to show up? All right, let's get a little technical for a second. The medical name is acne vulgaris. And this definition is super important because it tells us exactly where the problem is, inside the hair follicle and its little oil gland. It's not about dirt on the surface of your skin. It's a whole process happening deep inside the pore. So what's the play-by-play? Well, it's basically a four-step chain reaction. First, the skin cells inside that follicle get all sticky and they don't shed like they're supposed to, creating a plug. Second, your oil glands go into overdrive, and all that oil gets trapped behind the plug. Third, there's a type of bacteria that lives on our skin, P. acnes, and it absolutely loves this oily, no-oxygen environment, so it starts to multiply like crazy. And finally, your body's immune system sounds the alarm, sees this as an invasion, and launches an attack. That redness, that swelling, that pus, yeah, that's just your body fighting back. So all that brings us to the biggest area of confusion. Let's tackle some of the most common myths head-on and see what the actual medical guidelines have to say. Oh man, we've all heard these, right? Stop eating chocolate, or you just need to wash your face more. Maybe get a little sun. Well, the science is pretty clear. There is no convincing link between things like greasy food or chocolate and acne. And sunlight? Sure, a tan might hide the redness for a little while, but it doesn't actually treat the acne. And scrubbing your face like crazy? That can actually make things worse by irritating your skin, because remember, the problem isn't dirt on the surface. So if it's not the pizza, what does matter? Well, science points to a few key things. Genetics are huge. About 80% of your risk is just inherited. Hormones are another big one, especially those androgens that go wild during puberty and tell your oil glands to work overtime. Certain medications can also be a trigger, and yet mechanical things like picking at your skin can definitely make that inflammation way worse. The bottom line here, it's biology, not behavior. Okay, so if it's a biological condition, how do doctors actually treat it? Well, they don't just guess or throw random creams at you. They use a really systematic approach that you can think of as a treatment ladder. But hold on. Before we even take the first step up that ladder, we have to get one thing straight about the goal. Treatment isn't really about zapping the pimple you see in the mirror today. It's about stopping that four-step process we talked about to prevent the pimples that would have popped up next week and the week after that. And that process, well, it takes time. The very first step for a doctor is to figure out the severity. Is it mild? Mostly just blackheads and whiteheads? Is it moderate, with a mix of those red inflamed pimples? Or is it severe, with lots of inflammation, maybe cysts or any kind of scarring? Where you land on this scale determines which rung of the ladder you start on. And you can see that logic right here. It's a step-by-step approach. For mild acne, you start with a single topical agent, like benzoyl peroxide or a retinoid. For moderate, you step it up, combining those with a topical antibiotic. And for severe, you add an oral antibiotic, like doxycycline, but you always pair it with a topical. It's just a logical progression, matching the intensity of the treatment to the intensity of the condition. Let's look at the workhorses here. Benzoyl peroxide is great because it directly attacks step 3 of our problem. It kills the P. acnes bacteria. It works really well, but it can be pretty irritating when you first start. And here's a pro tip you have to remember. It can and will bleach your towels, your pillowcases, and your clothes. Now, local retinoids, they attack the problem from a totally different angle. They go after step 1. They basically teach your skin cells how to shed properly again, so that initial plug doesn't even form. They can also cause some irritation and dryness, and they make your skin way more sensitive to the sun, so daily sunscreen becomes non-negotiable. And this is absolutely critical. They cannot be used if you're pregnant or breastfeeding. Okay, this next part is basically the golden rule of modern acne treatment. If a doctor prescribes an antibiotic, whether it's a cream or a pill, it has to be used at the same time as either benzoyl peroxide or a retinoid.
Why? Because just using an antibiotic by itself is the perfect recipe for creating superbugs, bacteria that are resistant to the medicine. This combination approach isn't just more effective, it's a much smarter, safer way to treat acne long term. But what happens when those first rungs on the ladder just aren't cutting it? Or for cases that are really severe right from the get-go? Well, that's when doctors move to the most powerful tool they have. We are talking about oral isotretinoin. This stuff is a game changer. It's incredibly effective and can often lead to a long-term cure. But with that kind of power comes a whole lot of responsibility, which is why it is strictly reserved for severe, scarring, or treatment-resistant acne. And the reason for all that caution is the list of pretty serious side effects. The risk of causing severe birth defects is absolute, it's not a maybe. It also causes intense dryness everywhere, it can affect your blood work, your lipids and liver enzymes, and it's been associated with mood changes. This is not a drug you take lightly, and it absolutely requires close medical supervision the entire time. For female patients, the safety rules are ironclad. There is zero wiggle room. We're talking about using 2 different forms of birth control for a month before you start, the whole time you're on it, and for a month after you stop. And you have to get a negative pregnancy test every single month before they'll even write you a new 30-day prescription. The safety measures are that strict for a very, very good reason. Okay, so we've talked about all these powerful medical tools, but here's the thing. They don't work in a vacuum. To really succeed, you need 3 key things: patience, persistence, and partnership. And it is so important to talk about the emotional weight of acne. Check out this study. It found this huge perception gap. 58% of patients felt their acne was moderate to severe, but dermatologists only classified 13% of that exact same group that way. What does that tell you? It means how you feel about your skin is real and it's valid, no matter what a clinical score says. Your feelings matter. Now, I want you to remember this number. 4 to 8 weeks. That's how long it takes for most of these treatments to really start showing a noticeable difference. You got to be patient. Remember, the goal is prevention. You have to give the medicine enough time to stop the pimples that are just starting to form under your skin right now. Because at the end of the day, success is a team effort. You have to stick with the treatment plan, even on the days when you feel frustrated or aren't seeing results yet. And you have to keep an open line of communication with your doctor. That partnership is absolutely essential. So, after all of this, what's the single most important thing to take away? It's this. Acne is a medical condition. It has a clear biological cause, and it has evidence-based treatments. It is not a character flaw, it's not a hygiene problem. So the real question is, are you ready to stop blaming yourself and finally start treating it that way?